Good morning, afternoon, and evening, everybody joining Nicole and I today. This is our very first live that we are doing on Health Pulse here at Question Pro. I'm so excited to be here today. My name is Artie Betty Pullins. I'm the President and Chief Healthcare Officer at Question Pro. And today we're going to be kicking off just talking about all things healthcare, generative AI, well-being and sentiment, and what everybody is thinking about in the healthcare ecosystem, launching and getting right into 2025. I'm really excited to have my colleague here next to me, Nicole. Welcome, and thanks for kicking this off alongside me. Why don't you introduce yourself to everybody and tell everybody where you're from, where you're located, and we'll get kicked off.
Yeah, thank you, Artie, and I'm really excited to be here talking with everyone. So I am Nicole Koenig. I am a account executive here at Question Pro, focused on healthcare, based out of the DC, Maryland area, and I have been working in the healthcare tech space, I'd say about 8-9 years now. And it's become a passion of mine. Everyone has a story on why healthcare is important to them. And maybe one day I'll share mine with you, but it's definitely invigorated me to leverage technology to help improve patient outcomes and patient success.
That is very exciting. And we will be talking about some of that. So maybe, it's time for some personal stories here as well. Before we get into our script, let me kind of set the stage of what Health Pulse is all about. Why are we here today? Why should you continue to join, follow us, like us, and share us? And let me give you some context. Question Pro has been around for 15 years. We're an experience management platform, but can collect data, insights for any market, any industry. And healthcare is something that's very near and dear to my heart. I have spent over, I'm going to probably date myself, over 15 years in the healthcare space, leading on the tech side, running my own healthcare consultancy, and now leading that on the Question Pro side of the family as well. So we will continue to have content here, webinars, internal, external guests, and talking about what does research, data, experience, employee sentiment, and the changes happening on the United States side of healthcare, and what does that really mean? What does that really do for us? So that is what Health Pulse is going to be all about. Next time we'll actually have a nice fancy cup of coffee. Maybe one of these days we'll do it in the evening and have a glass of wine.
A coffee chat and a happy hour.
There you go. I love it. I love it. So in today's episode, let's talk a little bit about AI, generative AI, and sort of getting everybody who is listening and or is going to listen maybe at their own leisure time of what to expect now that we're in 2025. We're actually going to start with a clinician's perspective. So Nicole, you and I know this. Question Pro ran a very detailed study in early part of 2024, reaching out to healthcare providers, practitioners, clinicians, nurses, asking them about, man, what do you feel about AI, the tools of AI, generative AI, and are you excited? Are you nervous? Or are the robots going to come take your jobs away? So why don't you share what the study actually came out with and what was some of the statistics we saw out of that?
Yeah, absolutely. Thanks, Artie. And some of these stats are really interesting. And I think I was not surprised by some of them I definitely was. One of them that surprised me was just the clinician awareness around all of the AI tools in the market. I mean, there's so many of them, from transcribing to those trying to help diagnose patients, but only 58% of clinicians that we surveyed were aware that these tools existed. I think that number is going to grow, right? At some point, it's going to be an unavoidable conversation. But the things that did not surprise me were mainly the trust. And I remember hearing about the trust from some clinicians at a HIMSS conference a couple years ago. There's just not enough. There's not enough guardrails around these AI tools yet to help diagnose patients or even help transcribe records correctly. And 42% of clinicians feel like they're just unprepared for this influx of data and tools that are going to be coming to them. And I think that creates that sense of distrust and unawareness and ambiguity as well. Only 40%, 4 in 10 of the clinicians that we talk to really like trust AI, which I think really gives you a good pulse of where healthcare is in regards to how artificial intelligence is going to work with them. And then finally, it needs to be, and I agree with this, it needs to have a lot more regulations around what it can do and what it can't do. Obviously our patient data is very sensitive, and we have many HIPAA laws regarding the guardrails around that. And how are all of these new tools and all these new capabilities going to keep our health data safe?
Absolutely. And you hit the nail on the head that I also was surprised about the number of clinicians that were aware of AI tool. Under 58% were sort of aware of this. I think the other thing that was also interesting, and we can share the granular study with our with anybody who's listening or watching, or just send us a message and we'll send you the studies. But how many clinicians in the field did not know what their AI process is, policy is, what are even the tools you're using? I think a lot of people just think it's ChatGPT, right? Came out a couple of years ago, made a big stink in the market, is still around. Is that going anywhere? OpenAI, etc. But I think people didn't realize whether in the hospital situation, manufacturing situation, insurance, or everyday application of patient care, what their hospital policy is, what their healthcare institution policy is, and what are they using or not. And I think that causes like anxiety, right? Like
it causes the distrust.
Yeah.
And it's coming from the IT side of healthcare that I have, and focusing a lot of time with IT and data center type teams. I mean, there's a disconnect between what IT and that leadership team is thinking about AI and what clinicians are thinking about AI. And, in order to use it appropriately and to be able to build that trust and awareness of the capabilities and what can be done and what should not be done with AI, both sides of the table need to come together and come up with a solution that is safe and effective for not only, your administrative technology staff, but your clinicians as well.
Oh, absolutely. And, one of the other data points we collected, so the first study Question Pro did in early part of 2024 is this sentiment and feeling and good, happy, bad, ugly fear around AI, generative AI, large language models. And what does that mean from a day-to-day perspective in healthcare? You mentioned HIMSS earlier, Nicole. We talked about it. Last year was the buzz at HIMSS and Vive and Health and CES. And the year has started. It has begun. Some of this healthcare buzz is out again. However, one of the things that was also interesting is nurses and techs and radiology tech or right in the field. And how are they feeling about this? Like you mentioned, distrust of data. We have that data, and it shows kind of the adoption, distrust, and kind of mismanagement of like, what's going to happen? But then when you look at the people side of it, right? These are doctors, nurses, clinicians. They're everyday great people taking care of us, taking care of healthcare ecosystem. I have nurses in my family. And I truly believe they are the backbone of patient care in the healthcare system. And the data of their feeling and satisfaction in relation to burnout was also very, very interesting. And I know you have a lot of background in healthcare too. So tell me your point of view on that perspective.
Yeah, it's a cause that's very near and dear to my heart. I don't know if cause is the right word, but it's definitely something that I hold near and dear. I have many dear friends that are nurses and physical therapists and occupational therapists who have just done, they've been burnt out, they've been tired, and it's It's not having the support on the floor that they need to take care of patients appropriately, whether it's from a leadership perspective or just a staffing shortage perspective. Nurses that have a 20-to-1 patient ratio, they're not going to be able to provide the level of care that they need to and want to provide their patients, which affects them mentally because they're not doing their job. Patients get upset. It creates this like steamrolling effect of issues. And they're also just not having the tools, or they're not aware of the tools that they have that could potentially make their life a little easier. And it's surprising to me that only 74% of nurses really are satisfied with their job right now. And the burnout rate is just way high, 40%. I think everyone experiences burnout in their career and in their life. That's just the way life is. And just burnout can just be, it can just be terrible, right? You're exhausted. If you're exhausted, it could lead to mistakes. It could lead to things being missed in a hospital setting. That's really, really, really scary. So I try to be to my friends, more of like an empathetic listener to them. There isn't a whole lot I feel like I can really do but be that listener. But different ways that they can work together and collaborate with their leaders and colleagues is something that I've tried to give them advice to, just to try and lessen their mental load so they can do their job effectively.
Yeah. Oh no, absolutely. And you're right. Looking at some of this data that Question Pro collected in regards to how employees, specifically nurses, are feeling within their jobs and how they feel or don't feel supported, which is really breaks your heart, right?
Yeah.
15% of nurses only, I should restate that, only 15% of the nurses that we surveyed felt supported.
Which is it's sad, and it's thinking of that from someone who either would be a patient or have a loved one as a patient. That's it's scary. Not that it's ever going to be anything intentional, but if their mental health is not right, nothing else is going to go right either.
I absolutely agree, right? Like their relationship between patients, patient care, caregivers, caregiver to my parents, my aging parents, and I rely a lot on clinical support outside of even the physician support or specialist support that you get. So this idea of not feeling supported, or and our data showed 57% didn't feel supported either, right? So it's kind of gut wrenching to see that data, but then it also correlates with, to your point, burnout, turnover, the shortage in the United States, at least, that we are having of medical experienced staff, and what has to sort of happen there. But here's an interesting thing in theming in 2024 between all these conferences, the events you and I went to, the customers, our customers, Question Pro in healthcare that we spoke with, and on the research side and on the patient experience side, bringing in digital health methodologies or AI or AI methodologies and tools. Now that could be an area that the industry is starting to sort of take away some of that burnout and take away some of that shift and burden, right? Both patients and clinicians. So what are some of the things that you saw 24 and now especially coming into 2025 in regards to sort of just digital health applications?
Yeah, one of the things that I saw in this, I thought this was really interesting, and I really hope that this year we hear a lot more about more organizations across all industries doing this for their employees, is actually leveraging digital health solutions to help their clinicians and nurses with fighting their own burnout, making sure that they are taking care of themselves. I am a big proponent of self-care, and I think everybody should be. And it's great to see some of these digital health solutions that are being provided by employees and insurance providers that are actually able to help you take that time, whether it's getting, having someone to talk to, or just having an app to use to get some quiet time. It's great to see them trying to leverage that from a mental health perspective for their employees. But on the other side of that, and kind of making the job a little more sustainable, There's a lot of really cool applications around effective transcribing, and transcribing notes and messages, from the clinician and the nurse to the family, or to the patient, keeping everyone in the patient's, care circle, up to speed and communicated on the latest happenings, which I think, that's always been a huge burden in healthcare. There's always some sort of disconnect because people are talking in different languages, and people might not just have as good of a healthcare medical background as others. And using these tools to help keep everybody informed and keep everybody up to date, I think is going to be huge for not only the patient experience, but the clinician's experience as well. And then I saw this app last year at HIMSS, and I really hope they are there this year. But it was a pharmaceutical app that was trying to help with making sure that prescription, the proper dosage, the proper times, the administration of these medications in the hospital. It's almost like a live track of when that medicine was taken from the pharmacy, when it was, in the patient room and was administered and by who, just to help with, eliminating that error, which from a nursing perspective, I can see being a huge relief.
Oh, absolutely. Some of these, and let me know when you're at HIMSS in 2025 in the next couple of months, if they are there, because man, as a caretaker, I have 2 aging parents, right? Like having these digital health, everyday health solutions in your house, in your home, not being able to be, the old school pill boxes are great Monday through Friday, different sides, AM and PM, but it is challenging. And, we are in the world of AI and digital innovation. So can we automate that a little bit and or get it connected? So yes, these, CES that always happens in the beginning of the year in Las Vegas kind of shows a lot of those innovations. I mean, you have HIMSS and Vibe and the sort of healthcare arena kind of wakes up as soon as we kicked off this year. So we'll see a lot of these digital applications. You mentioned transcribing of notes, what to do post your even if just the regular doctor's appointment, right? Forget about operative care. The percentage of digital health solutions that are going up based on the data we had collected is significant. Mobile health apps have gone up to about 42% of our audience that we surveyed said, yep, they're using some sort of mobile health apps. Telemedicine, yes, it skyrocketed during the pandemic time, but post-pandemic era, people are still doing this in order to connect, get pre and post-operative care and solutioning. And then obviously the rise in consistent usage of patient portals, kind of like Epic or Cerner of the world. There's about 60% of our audience said that, yep, that keeps them connected and keeps them sure that they're comfortable with the level of sort of data going back and forth. So it'll continue to be interesting, the amount of digital application. I see both you and I are wearing our Apple Watch, right? You see a lot of the rings. There's sensor technologies all over the place, whether embedded in your body or these days.
We're almost there, I think, unfortunately or fortunately, depending on how you look at it.
But the data collection of it will continue to happen, right? How do we collect good quality health data and then bring it back to patients like you and I, or caregivers like you and I, clinical teams that we rely on to make good medical recommendations. And then it's already happening, but it's going to skyrocket. How do you use that data to inform healthcare insurance for reimbursements, Medicare, Medicaid, CMS? And you and I see a lot of that in the patient safety survey data we run for our hospitals, as well as the just overall quality survey data that we collect for our manufacturers, like a Medline or an Abbott or an AbbVie that we work with. Some of those trends will continue to accelerate going into 2025. I'm pretty confident, excited about it.
Me too. Me too. It's going to be really interesting, and I think this is the kind of the golden opportunity for AI to shine and show its power in helping in a healthcare setting. I mean, the other, another really interesting fact in this survey around digital health is almost 87% of people have an overall satisfaction rating with digital health solutions. So, I mean, obviously they're not going anywhere. With that high of a score, it's obviously worth an investment and a look from from medical healthcare organizations. And this is just a great opportunity to look, okay, how can I make this even better? And for me, I hope a lot of people will be shaking their heads when they hear this. If you could easily access all of your medical data in one single repository, maybe two, right? I mean, kind of wishful thinking for one, but and that's where I think AI can come into play. I really do. I think I think we can make AI smart enough and safe enough to leverage their technology to put all of our data into, just less repositories, so that we don't need to log into Epic, and we don't need to log into Cerner. We don't need to log into CVS to check our prescriptions. We can log into one place to look at all of our doctors, all of our visits, the last notes, the refills, when you're due for more lab work. It's obviously going to take it's going to take a lot of people to kind of help that algorithm. But I think it can be done. And I think that's where the trust can be built in AI. And then it'll just kind of steamroll from there into an overall good digital health experience for the patient. And, hopefully clinician satisfaction rates with AI improve with that as well.
Yeah, I totally agree with you. I mean, we're talking about the clinician side, right? But if you look at the patient or the consumer of healthcare, which is people like you and I mean, that adoption of comfort of AI is still very low. Earlier I mentioned sort of on the clinician side, only based on our survey and data that we did, only approximately 38% of the people we talked to were comfortable with AI. They were like, yeah, I'll listen to it. And then 35% were actually not. So the value to increase the comfort level and the trust, as you have also said, and hey, this information is coming back to me. I should take my prescription, or I should reach out to my doctor, or I should look at my my report that is in one of these EMR and EHR systems, will just drive better behavior. So Absolutely. This is all very exciting stuff. I'm even more excited to see what continues to come out of, as you and I are at these events and conferences, as we bring on more guest speakers to our little community here through HealthPulse, and as Question Pro continues to collect more real-time data on the research side of healthcare, on the patient care side of healthcare, or on the employee experience and employee sentiment side of healthcare. So I'm really excited. Thanks, Nicole, for kicking off this very first HealthPulse with us in January, right out of the gates. We look forward to you joining us more. Subscribe, like, share. We will share the data or the studies Nicole and I mentioned that Question Pro collected all of 2024 last year, and we'll also kind of share what we're thinking about for 2025. Thank you again, Nicole.
Yeah, thank you so much for having me, and thank you everyone for watching today.
Talk to you everybody later. Thank you.
Bye.